Dr. Dennis Lox, sports and regenerative medicine specialist. Today we're going to talk about an interesting case. This is a regenerative biotech expert by day, kung fu master by night. What do I mean by that? He happened to work for a biotech company that I know pretty well, and they do really interesting regenerative medicine work. I have lectured to university professors nationally and internationally, so I know a lot of these people. So I had good knowledge of their company and their president, and had worked with them in some lectures. And so he came to me and had a very good background of in-depth regenerative medicine and the science behind it. So that's what he did by day, but by night he was a kung fu master. And a lot of my martial artists take a beating over the years, and he was in his probably late 50s, early 60s, and when you've been doing martial arts for 40 years, it takes a toll. It was his hip. And when you're doing a lot of kickings repetitively for 40 years, it's not infrequent that these people have arthritic hips, which is what he had. So he came to me because he taught martial arts, particularly kung fu, and he didn't want to stop teaching kicking techniques. So he didn't want his hip replaced, and since he understood the regenerative world, as he was deep in it during his occupation, and his company knew me, he flew in from the Washington, D.C. area and came to see me, and we agreed to treat his hip. He had moderate arthritis. He was an excellent patient. Most martial artists follow or listen to my advice, which he did. He refrained from kicking for a good period of time, but I let him train other aspects, especially his upper body work, and about 6 months we let him go back to doing light kicking, and he progressed and did very well. Usually it takes elite athletes about 6 months before they can resume full contact on difficult sports. Of course, with his advanced age and already having arthritis, you want to minimize excessive trauma, so we're having to work on not kicking as much and doing more teaching. But interesting case of a guy who understands regenerative medicine backwards and forwards, but uses his body at night and abuses it. So just like myself, he's an expert in regenerative medicine and also a patient.